In this video, we're going to be talking about ovarian cysts. An ovarian cyst is a fluid-filled sac forming on or inside an ovary. We've got many different types of cysts, and I've created this flowchart to help you out. So we can broadly divide them into functional cysts, benign and malignant cysts. Functional cysts are physiological and related to the menstrual cycle, while the others are pathological. So as part of the functional cysts, we've got a follicular cyst, which forms when a follicle doesn't release an egg and keeps growing. A corpus luteum cyst develops after ovulation, when the follicle reseals and fills with fluid. A hemorrhagic cyst is when bleeding happens inside one of the functional cysts above. Functional cysts usually resolve spontaneously within a few weeks, but sometimes can rupture and cause pain. Now, as part of the benign cysts, we've got a dermoid cyst, also known as a mature teratoma. These contain different tissue, like hair, skin, or teeth. They are usually benign, but can grow quite large. Next, we've got an endometrioma, also referred to as a chocolate cyst, as it contains old dark blood and is caused by endometriosis. A cyst adenoma is a benign epithelial ovarian tumor, developing from the surface epithelium of the ovary. There are two main types: serous, containing a watery fluid, and mucinous, with thick and sticky contents. PCOS is another common condition with multiple small cysts. Then we've got the malignant cysts. So here we've listed the serous cystadenocarcinoma, mucinous cystadenocarcinoma, and clear cell carcinoma. These are the most common types, but there are many more. I'll be making another video going in further depth. In this list, I've also added borderline tumors. Borderline tumors lie between the benign and malignant tumors with abnormal cells but no invasion. So here basically we have a simplified classification of ovarian cysts, including the most common types. Now, besides classifying the different types of ovarian cysts, it's also useful to look at a possible differential diagnosis of an adnexal mass. This includes a hydrosalpinx or pyosalpinx, which refers to a distended fallopian tube with water or pus respectively, a tube-ovarian abscess, which can form in the presence of pelvic inflammatory disease, a peritoneal inclusion cyst, and a paraovarian cyst. Okay, so back to our ovarian cysts now. So how do they present? So most are asymptomatic, and patients won't be aware of the cyst. Others can present with abdominal pain, abdominal bloating, and dyspareunia, while others can present with acute complications of an ovarian cyst, referred to as an ovarian cyst accident, which can occur with both functional and pathological cysts. This includes a ruptured cyst, where the cyst wall tears and its contents spill into the pelvis, causing sharp acute pain. We can also have bleeding occurring within a cyst, which can then leak blood into the peritoneal cavity. Lastly, we have ovarian torsion, where the ovary twists on its pedicle, restricting its blood supply. We have a whole video all about this, which I'll link here. Good, so next, how do we assess these patients? We should first perform an examination, which involves a bimanual vaginal examination, and with large cysts, an abdominal examination too. An ultrasound scan is of utmost importance to assess the characteristics of the cyst and help us understand what kind of cyst we are dealing with. Blood tests can also help to give us a better idea of the type of cyst. We're going to be delving more into the assessment of ovarian cysts and management in our next video, so stay tuned for that. Like and subscribe.